Last Thursday, many of you joined us in this room to discuss the status of COVID-19 in our community. Dr. James Porter from Deaconess sat right there and explained the positivity trend amongst those being tested in Vanderburgh County is going the wrong way. Our county health officer, Dr. Ken Spear, also cited specific examples of age groups and gatherings contributing to the increase in cases. At that time, we implored the community to be vigilant and take steps to stop the spread of the virus. Since then, the issue of wearing masks has dominated public dialogue and in some cases become quite divisive. Let's be candid. We all have the same goal, and that is to stop the spread of the virus. We all want schools to open and be safe. We want businesses to open to full capacity and rebound from what has been a devastating business climate. I've consistently held that with all that government is doing, from testing to tracing to offering best practices from our medical advisory group on how to reopen business, government should not also be required to have citizens do the right thing by wearing a mask. But I've also said that the time may come with our daily numbers, that is the day-to-day data that shows how the virus is spreading in our community, may give us a different direction. From the beginning of the pandemic, I've relied on the expert guidance of our medical community. Deputy Mayor Steve Schaefer pulled together a phenomenal medical advisory group that has offered us guidance on every possible issue. We met again early this morning. Unanimously, they are recommending that we proceed with a mask directive to help slow the spread of the virus and to protect the public health. I concur with that recommendation. Today's results, along with the numbers of the past several days, support the guidance from our medical advisory group, represented by Deaconess Hospital, Ascension St. Vincent, and the Vanderburgh County Health Department. These are the medical experts in our community. If you're like me, when you go to your doctor, something may be wrong, you take their advice to get better. And that's what we need to do as a community. So what does that mean? For many of us, it simply means we continue to wear a mask. I put it in my pocket. We simply continue to wear something that most of us have started to wear for a while now. An executive order is being drafted with a directive to wear a face covering beginning next Wednesday, July 15th. Although anyone not wearing a mask, don't feel like you have to wait until next Wednesday to begin. The details of the order will be announced early next week in advance of the start date, but by and large, face coverings will be required in indoor public spaces, and we will strongly encourage businesses to also require them. I know there will be a lot of questions about enforcement. Let me just say that law enforcement will not be redirected from their normal duties unless of a physical or public dispute. And let me be clear, at this time, we are not considering fines. I look at this just like the stay-at-home order. We relied on our fellow citizens to do the right thing. I just got off the phone literally with Governor Holcomb literally just before I could walk back to the podium to inform him of our announcements, and he told me West Lafayette is doing the same thing. So there are other cities, other communities facing upticks in numbers around the state that are taking this action. The recent spread of the virus in our community is dramatic. I think wearing face coverings is one easy way to stop the spread and avoid future drastic actions that no one wants to take. Just this morning, the general manager of a major regional employer emailed me and requested that we order a complete shutdown of our community. We're not doing that. But that's just not practical. We are reopening our community, and we need to keep safeguards in place to ensure a healthy, safe reopening continues. The start of school is right around the corner. I know that Dr. Smith and his team are making multiple contingency plans, and I know that they are very confident that masks help and protect their faculty, staff, and most importantly, the students. So with that, I'll introduce Dr. David Smith from the EVSC.
Thank you, Mayor, and I applaud your leadership. During difficult times, difficult decisions need to be made. This is not one that I know was entered into lightly, but I also know that as you govern, you don't view your job as doing what necessarily is popular, but you do view your work as doing what is essential for the success of this community. I've said now for quite some time that as restrictions may be lifted, people think that precautions then are lifted, and they're not. As restrictions may come and go, precautions must remain in place. Precautions: frequent, thorough hand washing, social distancing, wearing a mask, and then cleansing and sanitizing high-touch areas. Those have to be in place. Anytime you put a mitigation strategy in place, it will take about 3 weeks to see the positive benefit of that, and we're about 3.5 weeks from the start of school. I've also said recently and frequently that the successful reopening of EVSC schools is going to be dependent upon the successful precautions that everyone in our community takes. Because we can be very efficient in what we do in terms of trying to mitigate the risk, but if folks in the community are not taking those precautions, then everyone suffers. So I applaud the mayor. I appreciate the actions that you've taken, because frankly, for those that don't want to do this, my question to you is, if not this, then what? Help me understand how we are to reverse the trend of increases in positive COVID-19 cases if we just continue to do what we've done. So I appreciate your leadership. I appreciate taking a proactive approach to this. It is, I think, essential for the welfare of our students, our families, and our community for us to try to return to some sense of normalcy, understanding that we're still in a pandemic, and with the conditions of the pandemic, then we have to make certain that we're taking the appropriate precautions. And only then can we return to this new sense of normal. Okay? Thank you very much.
Two members of our medical advisory group are with us this afternoon. Representing Deaconess is Dr. April Abbott.
So at Deaconess, we also have been very proactive about ensuring that we have played our role in universal masking. So we were very early in terms of adopting that. We recognized pretty early on that that is part of a multi-pronged approach that is absolutely critical to control the spread of coronavirus. We're well aware that our rates are going up. As was mentioned, several times already, we've been in constant communication concerning the fact that although we have increased testing, it's not just the number of positives that have gone up, it's that percent of positive cases that have gone up. And the steps that we're putting in place really are to help us maintain and flatten that curve and help to reduce further spread of this. As was mentioned, Deaconess also supports universal masking and mask wearing. We do believe that it's part of the approach that's necessary to slow the spread of coronavirus. And the key item to take away from the earlier message is that we sometimes get a false sense of security when we see that no one is sick presently right in front of us, but we do know that sometimes patients or individuals are capable of spreading coronavirus whenever they're not showing symptoms, and so they often can go on to develop symptoms later. That's something that we now appreciate more in the medical field, and so we're definitely looking at those cases to help control the spread. So masking, wearing both helps protect the individual themselves, but also protect the individuals that are coming in contact with that patient, because they may not know that they're soon to become a patient in the hospital. Healthcare workers have been in this heightened sense of providing care for patients for a very long time, and we really need everyone to do their part in ensuring that we can continue to provide the best medical care and keep beds open, so that as we enter, individuals re-entering schools, re-entering society in different ways, as we enter respiratory viral season this fall and winter, we do expect that bed capacity is going to be different than what it is currently. So we definitely applaud the mayor and the steps that are being taken.
Okay, from Ascension St. Vincent is Dr. Kristen Buchel.
Hello, good afternoon. Thank you, Mayor, for having us. And been very thankful at Ascension St. Vincent for having the mayor as well as the whole community being very responsive and receptive to the guidance that we've been offering to all. Also at Ascension St. Vincent, we've been very proactive about masking and promoting that across the board. We've, within our facility, have had masking the whole time, and we've also created separate tracks within the hospital trying to separate our patients who are at risk or who have coronavirus from those who are not. We can't underscore enough the importance of masking and how important it is to preventing the spread of coronavirus. We're quite concerned, as we told the mayor this morning, about how our positivity rates are increasing, our total positives are increasing, and this is a drastic change over the past few weeks. We really would hope that we can make a change to this. As a parent and as a pediatrician, I desperately would love my own kids to be back in school and seeing all the other kids back in school here in 3 weeks, and this is something that we really need to put into place to help stop the spread of coronavirus. So again, please do follow this directive from the mayor and do what's best for all of us and our families. Thank you.
The Vanderbilt County Health Department is also a member of our medical advisory group. The county health officer, Dr. Ken Spear, could not be here this afternoon, but Administrator Joe Grease is. Joe?
Thank you, Mayor. Appreciate the opportunity to be here as well. The health department has been working with everybody here since the beginning of this. Dr. Spear has said many times that we have certain tools at our disposal to help the spread, reduce the spread of the coronavirus in our community. And again, as everybody's said up here, social distancing, washing our hands, wearing masks when we're in public, when we're around others is key. And so we agree that this measure is being taken. We appreciate being a part of the team and working with everybody. And hopefully this will continue to move us forward, as the mayor has said. So, thank you.
May have some questions. We'll be happy to take those now.
I guess just in terms of restaurants and areas like this, and perhaps this is a better question suited for medical professionals, in terms of those areas where wearing a mask is very difficult to enforce, what do you think should happen in those areas?
First, I would just offer that there will be, the specifics of the order are not finalized. They will be finalized early next week before the directive takes effect. So you can be assured that questions like that will be more easily answered at that time. But I don't see anything different next week with the order than what we have in place now. When you go to a restaurant, and I've been to many restaurants, I walk in with my mask, I unmask when I order, when it's time to eat, when it's time to pay my bill and leave, I put my mask on and leave. We're not asking for anything more dramatic or different than that. I expect that will continue. If you're walking by yourself outside, you're not going to have a mask. If you're walking with someone and you can't be 6 feet apart, you need to have a mask. Now, if you'd like to expand on.
Yeah, I think that masking, of course, is. Oh, sorry. Of course, masking is only one part of all this. So social distancing, hand hygiene, being thoughtful about your contacts, and so going to a restaurant, as Mayor Winnecke said, many of the restaurants I've been to as well have taken those precautions. They've socially distanced. They are promoting hand hygiene. The servers and so forth are doing the appropriate steps necessary to help limit that. From our perspective as a patron of these restaurants, definitely wearing your mask in, those part of that concept is that's when you're going to be closest to other people. And then when you're set at the table, that's when we'll be socially distanced through the table spacings and arrangements. So it shouldn't change that. We're just asking for everybody to stick to masking, especially when we're at the store or other places. Those are some of the places where we're more concerned about the interaction and the closeness to each other.
guys are pretty quiet, but it's late on a Friday afternoon. I would just say this, perhaps in conclusion, and this may prompt Dr. Smith to add a caveat, but the trends are going the way they are. If they continue, it puts a lot of things in jeopardy, and it causes more contingencies to be made. And one of the paramount concerns on the minds of probably every person in our city is the safe reopening of schools. And so Dr. Smith has to prepare for all the options of reopening, but if the trends continue, what happens then? And we don't want to get to that point, and I know he and his team do not want to get to that point.
So I'd be happy to address that, but I wish that I wouldn't have to. But I think you're exactly right. We have over 5 million square feet under roof. We've been through every square foot of our facilities so that we can ensure that we will have the proper social distancing within our schools. But we cannot do this by ourselves. That's why I think this is so important. Once again, I applaud your leadership, and it is imperative that we rely on one of the outstanding strengths of our community, and that is to always work together in a collaborative manner. While you may not enjoy wearing a mask, you're not wearing it for you. You're wearing it for my mom, who's 88 years old and in a nursing home. You're wearing it for those that perhaps cannot get through this by themselves. So I implore you, please do what you know you need to do. While it may not be comfortable, let's do what we need to do on the short term so that a year from now, we emerge from this stronger than we have been.
Okay. No other questions. Thanks, everybody. Have a good weekend.